Welcome. Today's video is on compounding part 1. In this video, we'll be reviewing compounding topics that you'll see on the NAPLEX. This is a 2-part series, so once you're done with this video, make sure to check out part 2. What is compounding? So we'll be starting off with the basics. Compounding. So in the field of pharmacy, compounding is the preparation of custom formulations of a medication to fit a unique need of a patient that cannot be met with commercially available products. These include products you see at Rite Aid, CVS, Walgreens, those commercially available products. Compounding drugs are prepared by pharmacists for individual patients. So a patient will use a compounding pharmacy, when the product or the medication has a unique dose or a formulation that cannot be already found as a manufactured product. We would have to make it kind of custom made. And there are 2 types of compounding. We have sterile compounding, which are for medications intended to be used as an injection, infusion, or application to the eye, anything that's going to go in our bloodstream. And we have non-sterile compounding, which includes the production of solutions, suspensions, ointments, creams, powders, suppositories, capsules, and tablets. So compounding can fall under these categories. Like we said, we have sterile and non-sterile. Sterile can further be divided into non-hazardous or hazardous. And non-sterile can also be divided up into non-hazardous or hazardous. Moving on to resources and standards. So we have the National Institute for Occupational Safety and Health. And this organization determines what's hazardous and what's not. We have the USP, which sets the standard for compounding preparations and sets the standard for the strength, quality, and purity of human and animal drugs for both manufactured and compounding drugs. USP 795 is the section on non-sterile compounding. And since it is compounding, again, the dose and formulation type cannot be commercially available. Changes anything in the medication except the active drug. So this is used when the active drug is going to be the same, but we're just going to compound anything with the active drug itself. So examples of this could be a change in formulation to avoid intolerable excipients. You could add a flavor and formulate a dose or formulation that is not commercially available. Examples: chicken flavored chewable levothyroxine tablets for dogs, or an antifungal lollipop for thrush for a child. Next, we have USP 797, which is the section on sterile compounding. And the blood is sterile, meaning we do not want any microorganisms in there. That would be very bad. So we need to follow this section for sterile compounding, make sure there's nothing in our blood. So in IV drugs, most of the time they're going directly into our bloodstream, so we need them to be sterile. Other products include eye drops, eardrops. They all need to be sterile because they're going into our bloodstream. And an example of this is prednisolone, 10 ml eye drops. We do want them to be sterile since they're going directly in our eye. So USP 797, sterile compounding. Moving on to USP 800, and this section is for handling hazardous drugs. They pose a danger to staff or anyone who comes into contact with them. So we do want to be careful when dealing with them. And characteristics that could make a drug hazardous are: it could be carcinogenic, meaning it could cause cancer; teratogenic, meaning it could cause birth defects; it can cause organ toxicity; it could also be genotoxic, meaning it could damage anyone's DNA. So it should be noted that prior to handling these drugs and medications, both men and women with the reproductive capability must confirm in writing that they understand the risks that are associated with handling these types of medications. Now, let's get into them. So, the next section is about hazardous drugs. So, hazardous drugs are defined by the American Society of Health System Pharmacists in 1990 as being a drug which displays one or more of the following characteristics, which we had just went over. We have fertility issues. They are carcinogenic. They could cause serious organ damage. So I would get to know those. And anyone handling these hazardous drugs that are able to have children needs written documentation that they understand the risks with these medications. So these include pharmacists, technicians, any nurses, and any lab staff that will be in the facility that will come in contact with these medications. So there are a good amount of hazardous drugs out there. Here are some to be noted. I would pause the video right now and just go over these, get a little familiar with them, write them down, and make sure you know that when handling these, you have to take these certain precautions that we're going to go into later on in the video. Before we get started, we're going to go over a couple basic compounding terms. First one being the primary engineering control, PEC for short, which is basically the fume head area. We have the secondary engineering control, SEC, which is the buffer room that houses most of the PECs. We have closed system drug transfer device, CSTD, and these are used to keep hazardous drugs contained inside the device, and they prevent spills and fumes from leaking out. We have the compounding aseptic containment isolator, which is an isolator glove box for hazardous drugs. We have compounding aseptic isolator, CAI. Compounded sterile products that come in IV drug bags will come in either a small or large bag. The small volume parenteral, SVP, is the IV bag that contains up to 100 ml, while the large volume parenteral can hold over 100 ml. So I would know that distinguishment, excuse me. They might ask you, for this medication, which one you would use. Moving on, we have the International Standards Organization, the ISO, which is a non-governmental organization who make the development, manufacturing, and supply of products and services more efficient, safer, and cleaner. And if they give you a number, then all you have to know that the lower the number, the cleaner the area is. Now, the two divisions of compounding, we have sterile versus non-sterile. So for sterile compounding requirements, we're going to have the ISO air. This is basically going to measure the quality of the air. Most contaminants come from the staff working at the compounding pharmacy. So we want to make sure the staff understands the compounding rules and regulations for sterile products. And because of this, when working, all workers must have at least 6 inches from the fume's front edge. Now, for non-sterile preparations, they should not be near the sterile areas. And when preparing these preparations, we have two types of water, basically tap water and purified water. We're going to be going over the hazardous drug requirements. So hoods and buffer rooms used for compounding hazardous drugs usually begin with the word containment. So you'll see containment PEC, short for CPEC, and containment SEC, short for CSEC. So for the SPEC, we're going to clean it with 70% isopropyl alcohol, IPA. And for the CSEC, the room where the SPEC is located, So we want to limit the hazardous medications to these two containment areas. And as you can see next, they both need negative air pressure. We need a compounding aseptic containment isolator. So this is basically another hood, but it's different from the hood being used in the CSEC. So air in the spaces used for hazardous drugs have required ACPH, which stands for air changes per hour, and is the number of times that the air is replaced in the room per hour. So for non-sterile hazardous drugs that are compounded, they need at least a ACPH of 12, while sterile hazardous drugs need spaces with ACPH of at least 30 or higher. When handling these hazardous drugs, the pharmacy needs an external exhaust. Air that has been contained with the hazardous drugs should be externally exhausted, meaning the air should go out of the pharmacy. And this is, like we just said, the air is moved out of the space and cannot be recirculated and returned to the room. It's sent outside and takes any contamination out with it. In a non-sterile hazardous room, the air should be externally ventilated, or a redundant HEPA filter could also be used. So under certain circumstances, an redundant HEPA filter can be used instead of an external exhaust. An example of this are areas where a contaminated air exhaust can be placed due to a local park. That air is going to be very toxic. So if there's a park there with children, we don't want that air going into that park and contaminating those children. So there are alternatives if needed. Next, the USP requirements. So we're going to be using the ISO to assess air quality. Like we went over earlier, the lower the particle count, the cleaner the air. So if we have ISO 5, ISO 7, or ISO 8, the ISO 5 will be cleaner than the ISO 8. Moving on to HEPA filters. HEPA standing for high efficiency particulate air filters. These filters pick up particles when the air runs through them. They are 99.9% efficient in removing particles as small as 0.5 microns. The direct compounding area is the area within the primary engineering control where critical sites are exposed to unidirectional HEPA filtered air. These areas are also known as first air. And for air pressure, when we are handling non-hazardous PEC and SEC, there needs to be positive pressure. When we are handling hazardous compounding CPEC and CSEC, there needs to be negative pressure. And here you can see the layout of the rooms. Any work performed in a PEC needs to be at least 6 inches from the front edge. There are two types of locations that can house a PEC: a clean room, which is one or more PEC within an SEC, including an adjacent anteroom, and isolators that are called compounding aseptic isolators, CAI for short. Isolators maintain an aseptic compounding environment to ensure complete sterility of the product. There are two types. We have the compounding aseptic isolator and the compounding aseptic containment isolator. There is a segregated compound area. The max beyond use date for CSP made in an isolator in an SCA is 12 hours. The PEC with ISO 5 air sits inside an ISO 7 secondary engineering room, and that adjacent anteroom may be an ISO 7 or 8. depending on the location. So the PEC ISO of 5, while the SEC is going to be typically a 7 or an 8. So to summarize a little bit, when we have sterile preparations that are non-hazardous, we could use a HEPA filter. We're going to need positive air pressure, and we're going to be using compounding aseptic isolator. For sterile preparation that are hazardous, we're going to be using a compounding aseptic containment isolator. Remember, we want that containment, so we don't want that hazardous air to get out. We'll be using negative air pressure with an external vent, and it's going to require, again, sterile preparation. Compounding personal training. So these medications need to be handled a certain way. So for any staff in the compounding pharmacy, they will need training. So the training consists of didactics and hands-on training. So you're going to do it initially, and then you're going to be trained thereafter. Any updates, you'll be need new training. They come out, once a year, so typically the training stays the same. So required training and testing, you're going to need to be tested on hand hygiene, garbing, and gloving techniques. And for this, you're usually gloved, and your fingertips are tested using tryptic soy agar. Passing required 3 consecutive gloved fingertip samples with 0 CFUs. This is required initially, then annually for low to medium risk. You'll be tested and trained on sterile drug preparation and cleaning and disinfecting procedures. You'll be required to take a media fill test, which is used to determine if a compounder is preparing specialty products in an aseptic manner. This test contains that tryptic soy broth, where you'll be tested to see in 14 days if any cloudiness will appear. If not, then you passed. If there is any cloudiness, then that means it is contained. So you have to retake the exam as well and wait another 14 days. The SEC must be monitored at least once daily, should be kept at 20 degrees Celsius or cooler. The refrigerator and freezer must be monitored twice daily. The temperature should be documented on a temperature log sheet. The refrigerator should be kept between 2 to 8 Celsius. And the freezer should be kept between -50 to -15 degrees Celsius. And they should be checked at least twice daily. For air sampling, this needs to be performed every 6 months by someone certified. Someone certified could be a certified personnel outside or someone in the compounding pharmacy that is qualified. So for surface sampling, polysorbate 80 and lectin are added to neutralize the effect of any disinfecting agents. So if you use any disinfectant agents before that, then that these two compounds will get rid of that. So the surface needs to be clean, and they'll be able to tell if the surface has been disinfected consistently or not. All tests should be done at the end of the day, because typically that's when the most bacteria or contaminants would be present. Surface samples are taken and incubated for 3 days, and the results must indicate 0 CFUs. Action must be taken if the sample comes back with more than 3 in the ISO 5 or more than 5 in the ISO 7 areas. For cleaning and protection, the PEC should be cleaned throughout the day. It should be cleaned with a germicidal detergent, disinfectant using 70% alcohol. ISO 5 PEC cleaned every 30 minutes while working. The PEC must be left on for 30 minutes if there is an power outage, and it should be cleaned from top to bottom and back to front, which will get rid of all of the contaminants if there are any. For hazardous drug compounding cleaning, we want to use bleach or peroxide for any decontamination. We want to use a germicidal detergent for cleaning, and everything we're going to use is sterile. For respiratory protection, first we're going to have a fit test because there are different sizes for respiratory masks, and the options do include a powered air purifying respirator or an N95 respiratory mask. When administering any hazardous drugs, you would need 2 pairs of chemotherapy gloves and a chemotherapy gown for IV drugs, 1 chemotherapy glove for intact tablets or capsules. For closed system drug transfer devices, you must be used by nurses for any drug administration. If you would like to discard any of this, you would need to discard it in a yellow bin. And if you are exposed to any of these hazardous drugs, immediately remove any exposed clothing or item. Clean any affected area with soap and water. If you are exposed in the eye, then clean the affected area of the eye using a eye wash fountain for at least 15 minutes or longer. And it is required for you to document any exposure. And after that, if needed, you could seek more medical attention. Personal protective equipment, PPE, that's going to be used for sterile hazardous drugs. You're going to have a head cover, a beard cover, if needed, 2 pairs of shoe covers, a gown that cannot be permeable, 2 pairs of ASTM, which are chemotherapy rate gloves, and your PPE for non-sterile hazardous drugs. You would need to be double gloved, a gown, a mask, and you are required to dispose of any pads or surfaces that you came into contact with. The disposal for hazardous medications, chemotherapy gown and outer shoe covers must be taken off before exiting the negative pressured air. They should be thrown away in the yellow chemotherapy waste bin. Anti-neoplastic waste, such as empty vials, empty IV bags, syringes, vials, should be thrown away in the same yellow container. But for bulk anti-neoplastic waste, they could be thrown away in black containers.